Welcome once again to one of our live streams, PMS Pmdd. Now, many of you might be thinking, I don't have that. I'm beyond that. I don't have that anymore. So you could be a 40 or 50-year-old, maybe you're menopausal, but you can very much help a loved one, a daughter, a daughter-in-law, a niece, by understanding some of these basic principles. It's a huge problem, very huge problem today. Premenstrual syndrome, where this is really occurring with women, is in the latter part of their cycle. So I'll get into the details. Make sure that you know we've got tons of live streams on all different types of subjects and topics that you are welcome to view. Obviously, just hit the archives button and it'll take you back through all of the live streams that we've done. We've got them on headaches and migraines and male hormones and female hormones and just a whole smattering of things. This one today I know is very specific to a menstruating female population, but it affects everyone. There's no one in the home that's not affected by this. So if you have a daughter, and you could be 50 and your daughter is 30 or she's 25, and she's having difficulties with PMS or premenstrual dysphoric disorder, I'll talk a little bit about specifically about what the differentiation of that is, that it affects your grandchildren. It affects your daughter or granddaughter's children or your children. It affects your relationship with your spouse. It affects relationships in all horizontal planes. And the simple reason is because women that are suffering from PMS, Pmdd, in many cases become completely dysfunctional in their life. They are anxious, they are irritable, they are emotional, there's mood swings, they can become angry, and then many things that they then do or act out further cause a decline in their functionality. So I want to put to rest that the notion that, number one, that birth control pills are the answer, and number two, that SSRI type medications or antidepressant meds are the answer. Because I believe what's happening is this is after the fact. I want to deal with the components at the beginning, at the starting line, not at the finish line. And why I say that is because brain neurotransmitters can be impaired in PMS and Pmdd, meaning that your sense of balance, your brain neurotransmitters are impaired. But are they impaired because you're truly depressed? Well, that's a whole nother subject. That's another live stream that we've got to build up your neurotransmitters, evaluate your neurotransmitters. Why do women have significant problems? Let me just map this out for you. In the latter part of their cycle. So let's just say this is your menses, this is your period, and then what you're going to do post your period, you're going to go into, this is the follicular phase, you're going to go into the ovulatory phase, you're going to have a spike in estrogen, and then something like this, and then your progesterone is going to do something like this. This is your progesterone, this is your estrogen. So here's where we have this problem with PMS and Pmdd. It is usually located somewhere in here. Day 14, 15, maybe more like 17 or 18, through the beginning, the starting of menses. So if a woman is truly anxious, depressed, moody, violent, angry, acts out, lashes out, and then eats a lot of bad foods and does a lot of things that feeds into this, if that were the case, why does she not do it from beginning to the end of the month, from day 1 through day 28? Medicine, I believe, is doing women a great disservice by literally saying that what we'll do is we'll treat you with antidepressants in here, or we'll put you on birth control pills and we'll shut down your hormones during this whole cycle. The reality of it is there's an imbalance of estrogen to progesterone ratios. That's where the problem is. If I have an imbalance in this scenario, I'm going to go over the specifics of different types. But there are significant issues right here. What we're going to be after is how do we balance these issues? How do we make sure we process them well, eliminate them? How do we make sure that you have adequate nutrients on boards to meet the metabolic demands? Why do some women get here and some don't? That's the $64 question. We don't always know. I believe there's a lot of environmental issues. There's a lot of environmental hormones. There's environmental components, of which I certainly don't want to get into and don't have the time today. So, are birth control pills or antidepressants, are they the answer? I firmly believe no. They should be the court of last resort if women have tried and have done some functional intervention and they have failed. So, you can have what's called PMS anxiety. You could have PMS, what's called hyperhydration. You could have PMS carb. Geez, I'm forgetting one. PMSD, which is more. So here's what this is saying. That there's 4 different types, and that at these different types that there are different levels, hormones that are being secreted and changed. So I'm going to have to grab this bench because my back is not feeling real good today. So we're going to have to kind of modify this a little bit. PMS anxiety is literally where you have an imbalance of your hormones. And a lot of times it's an estrogen dominant situation. So I've got too much estrogen. I don't want to get into a ton of details, but this, if you really want to break this out, there's an estrogen and a MAG issue and possibly a progesterone issue. With PMS, hyperhydration, sometimes, this is rare by the way, it's an excess of progesterone. That's rare. Carbohydrate intolerance. This is an estrogen and a B issue and a MAG issue and possibly a progesterone. And PMS depression can encompass numerous issues here as well. So from this standpoint, the way we want to look at this is that you've got to see that what we're after is that we need to kind of address this from multiple layers here. And I'm going to say to you, what we want to do is to make sure that we are looking at all of the factors. I don't believe that a fluoxetine or an SSRI pharmaceutical is the answer necessarily. Now, if you've got depression and you've been on that medication and you have it day 1 through day 28, that's a whole different subject. That's not our discussion here today. Our discussion is going to focus on how do we keep you balanced in that latter part of your cycle. How do we manage those aspects of your hormones? So, PMS, PMDD, medicine would say if you've got PMD, there's a criteria, 11 different criteria, where it's interfering with your day-to-day function, your ability to manage work, life, home, your children, and it is now impairing the quality of your life and the ability to function in your life. And I believe you have to hit 6 of the 11 criteria, and they're going to say, now you need to be on whatever, fluoxetine, an SSRI pharmaceutical. But usually what you'll see is this is always in that latter part of the cycle, all right? So I drew for you the 28-day cycle, and you have a better handle, you have a better understanding of that. So let's talk about what some of the real symptoms are. There's going to be a lot of breast tenderness. There's going to be a lot of anxiety. There's going to be a lot of mood instability. There's going to be a lot of cravings for carbs, sugars. There's a lot of fluid retention. Now, I'm not naming them all. I'm going to give you a smattering. There's more headaches. There's the possibility for migraines in here, sometimes right at the middle of the cycle, sometimes in that second part of the cycle prior to menses. I mean, this is just a smattering. Breast tenderness, tremendous fluid retention, more anxiety, more irritability, more mood instability, carb cravings, headaches, migraines. I mean, the list literally just goes on. Low back pain, low menstrual pain. Acne is a huge issue. More tension, more tendencies towards depression in the latter part of that cycle. This is a big issue. More tendencies to be blue, to be down. This is where this PMDD diagnosis comes in. Again, do we go to the end of the issue and say, well, the result is I have all these symptoms and now treat me with a drug? Or do we try to eliminate the symptoms by balancing hormones, processing, et cetera, et cetera? Obviously, it's going to make sense to do that. Balance. What are some contributing factors? Some contributing factors are going to be, first of all, just a poor diet. I don't eat well. I eat a lot of fats, bad fats. I'm exposed to a lot of chemicals in the environment. I have a lot of nutrient-depleted foods. I eat more carbs and sugars. I don't have enough fiber and good bacteria in the gut. I think you get the picture. Now, I'm not saying that this is the cause of your PMS. I'm saying that these factors influence. So the more junk you eat, the more processed refined, the less fibers you eat, the more simple refined carbohydrates, the more sugars, the more devoid of fibers and antioxidants, you will feed this whole cascade. And then you will set up more of an estrogen dominance, a progesterone deficiency. You won't excrete your hormones well. And now I'm going to be dealing with anxiety and depression. Folks, there's a reason for this, and it's an imbalance in your hormones. Shutting down ovarian production of those hormones, I really don't believe is the answer. Let's facilitate the pathway. Let me clear up another issue. You're not crazy. Now, I know I'm going to offend some people by using that, terminology, but I think this is important for us to understand because a lot of women begin to feel that they are just completely off their rockers. I say things and do things right before my period that I can't even believe I say and do those things. I hate myself. I cannot believe that I treated my children that way. I can't believe I spoke to my mother that way. I can't believe I was that harsh to my husband. When I'm saying it, I almost feel like I'm having an out of, God forbid, body experience where I'm actually hearing myself say these things and I don't even know who that person is. That's not really me. But I'm angry. I want to lash out. I want to get in your face. I almost want to hurt your feelings. And I've worked with women for a long time with this, and literally they'll just begin to tell you, I feel like I'm crazy. So when my doc said that I need to go on an antidepressant, I went for it because I really began to felt as though there was something wrong with me. But once again, I will say to you, is it every day from 1 through 28? Or is it just kind of in that 14 to 28 or 21 to 28 day range? I know there's a lot of physical symptoms. Low cramping, low backache, fluid retention, enlarged breast tenderness, headaches, migraine. But there is a tremendous amount of emotional, this is where we came up with this PMDD concept. There's a lot of emotional issues here, and women begin to think that there's something radically wrong with them. But then what happens many times for many of you, as soon as you have your period, it's like someone just lets the air out of the room. I suddenly can think more clearly. I don't feel as anxious. I'm not as moody. I'm not as blue. I'm not as down. I can make rational decisions, whereas in these scenarios, when I'm in the midst of this, I can't make a decision. I don't want to make a decision. I feel like I'm not capable. I want to fight with people. I'm angry. I'm distraught at times. I have highs and lows. So if the case were that you were that way from day 1 to 28, another discussion. So let's get down to some of the core issues. Let me make sure I didn't miss anything. PMS, let me just go back through these real quick. PMS, anxiety, just so you understand, with this classification with anxiety, with this hyperhydration, meaning I'm very fluid retentive, or I've got more anxiousness, and the cravings, right? So anxiety, the cravings, and then lastly, more of the depression. The occurrences, about 70% of the women have the anxiety portion of this with PMS, 70% of you. The hyperhydration, the fluid retention, I've got bloating, my ankles swell, I feel like I can gain 5-6 pounds before my period. Probably 70+% of the women experience this. The craving portion is probably about 30 to 40% of women. The depressive side of this is 30+%. Now here's the key. The key is, in order to be qualified or technically have this PMS diagnosis, you don't have to have every single one of these 100% of the time. Some women will have more of one. Some people have horrible cravings. They eat everything in sight. They bloat. They feel horrible. Others, they're more moody and depressed. Others, it's anxiety. It's irritability. I'm unstable emotionally. I'm fighting with everybody in my home. So just so you can see. Now, a lot of purists say, well, then what we need to do is you need to define, and years ago that's what I try to do, is to define, where you fell in that category. And then I would begin to try to gear my support for you and my help for you there. I've changed that. I feel like you've got to deal with some real core issues. Number one, estrogen or E2 metabolism. For many of you, something's wrong here. What I mean by metabolism, it's how your liver's handling it. Number two, we have a progesterone deficit. Not always, but in a significant portion, there's a progesterone deficit. We have nutrient deficits. In specifics, B6, magnesium. Now, there are some other things in here. Zinc. But these are the basics. I want you to just follow this rationale. Just very, very simple. I want to make this simple. I don't want to have this 100 steps to PMS and PMDD answers. No, I'm going to keep this simple. But I need to give you this as an overview. So I could have too much estrogen. I could have not enough progesterone, or both. I could have poor handling or metabolism, or better yet, shall I say, elimination of estrogen. I could be deficient in some nutrients. The next layer is liver. Because of many environmental issues, chemicals that we're exposed to, constipation, not understanding how to support liver function. Many of us are exposed to a lot of environmental chemicals through our foods, environment. The liver becomes congested. Do you know that they find that even women, 30 and 40-somethings that have significant gallbladder dysfunction or gallbladder congestion and bile acid stasis in their gallbladder have much higher rates of PMS? Why? Because part of your elimination, it's just as important that you eliminate, metabolize, and eliminate your hormones as it is that you make balanced numbers. So it's one thing to have enough. That's one check mark. How do I process and eliminate? It's second check mark. So if I'm deficient, I need to right that wrong. If I am not eliminating, I must increase elimination pathways. Otherwise, these estrogen metabolites become toxic to me, and they aggravate the PMS structure, premenstrual syndrome. Do I need to be on an oral contraceptive? I don't know. I mean, I could go off on a lot of different issues here. There's, when there's poor hormone handling, there's issues with uterine fibroids. There's higher rates of endometriosis. Now, endometriosis has an immune component and a chemical component to it, some autoimmune areas. I could have more cystic issues, polycystic ovarian. And then my testosterone begins to rise. My point is, fibrocystic breast is a lot of poor hormone handling and iodine deficits. So there's a lot of different directions you go here, but I want to keep this to right to the premenstrual, the PMDD. I am crazy for a week before my period or 2 weeks. I just can't function. I've got to evaluate my hormone levels, and I got to make sure I'm processing and eliminating those guys. Number two, I've got to know what my progesterone is. If my progesterone is in deficit, estrogen dominates, and I will be headachy, I will be moody, I will be fluid retentive, I will have more breast tenderness, I will have tendencies towards depression. The wheels come off of the wagon. But what if those two are not bad? What if I'm actually pretty balanced here? But now if I have some nutrient deficits, I'm going to be more prone. What if my liver is impaired? What if 1, 2, and these 3 are all good? But if my liver is impaired and I'm not excreting well, I have a whole nother issue and a whole nother problem. I think when we look at this, we've got to understand that maybe even the unseen area is even gastrointestinal health, GI health. So why I'm fanatical about us drinking enough water, about us eating plenty of fiber in our diets, about having real foods, live foods, so I can make good bacteria or take probiotics. So I'm very fanatical about this because the last step, now, there's more to this, but for sake of today, this is all we want to cover. If I have poor GI health and I've got low fiber status and bad bacteria, what I'm going to do is have, I want you to listen closely, please. This is very important. If you have a history of antibiotics and you are making an enzyme that is called beta, we all make this, by the way, glucuronidase, and it's high because of antibiotics, because of stress, because of a lot of sugar in your diet. If I am making a lot of this bugger in my gut, I will recycle all of my estrogen metabolites, and I will enhance PMS. I will enhance hormone-related problems. So even if my saliva samples, my body stores of my own estrogen and progesterone are balanced, and if my liver's okay, and I've got adequate nutrients on board, I hope you're following the picture now, but now my gut is totally dismembered because of antibiotics in the past, and I just don't eat that well, and I have a lot of beta-glucuronidase. You recycle what we call estrogen metabolites. You send them back into your circulatory system, and they recycle, literally, and they become stimulatory, and they become aggravants. All right? Are you crazy? And again, forgive me if I'm offending anyone, but I need to make a point. No. Do I need to do just pharmaceuticals to get out of this? I don't believe so. But I don't believe what you do is, for example, people have said, well, I tried B6. Well, and it helped me a little bit, and I didn't have as much fluid retention, but it didn't really help me. I tried magnesium. Well, first of all, what was the source? What type did you use? That's really key. Did you absorb it? Because if you don't absorb it, I don't get much benefit. I tried progesterone, and it helped me a little bit. I hope you're getting the picture. See, many times what you'll do is you'll try this or you'll try that. Someone told me to use, Agnus castus.
Someone told me.
Yeah. Someone told me, I heard, I read. Okay. So then I try these individually. Now remember, it's complex. PMSA, PMS craving, PMS hyperhydration, I'm fluid retentive, PMS depression. Some of us got a little bit of all of that going on. And you want to try to right those wrongs with one nutrient. And then when it doesn't work, you cross it off and you say, well, then I got magnesium and I tried that for a couple of months and that didn't work. Then I tried, no. What we're going to do is put together a plan. So we're going to make sure that we want to know that hormones are balanced. We want to make sure that I excrete them well through my liver. I'm going to make sure that my gut doesn't recycle them, that I eliminate them well through stool and actually through urine as well. That I need to correct underlying deficits of some of these nutrients. So now what I have is a plan. And when you have a plan, I believe very cleanly and clearly, I will tell you that if you do this, and you're going to follow after the break, the plan that we give you, if you follow that, aggressively for 3 cycles, 3 months, I can't make you guarantees, but I will be stunned that if you don't have somewhere in the neighborhood of 50 to even up to 80% improvement in how you feel, of the irritability, the emotional instability, the depression, the fluid retention, the headaches. Headaches and migraines can be one of 2 things. They can be estrogen lack at the middle of the month and at the end of the month, or it can be progesterone lack. So that's a little trickier. So sometimes you don't get to the root of that one unless you really do some specific testing. But general theme, if I don't have 50, 60, 70 to even 80% improvement after 3 cycles, if I legitimately follow this, I will eat my hat. There's something else. I don't wear a hat. I'll eat my sweater because I usually wear a sweater. Whatever. Right? Here's the other thing. This last thing before we go to this break. Remember that in many cases, here's what's really scary about this. When I'm in the midst of this, many times then my choices of food and what I eat are so bad that it literally drives me deeper. And what I mean by that is, when I start consuming more sugars, more whites, more refined, more processed, what is actually happening? I am going to impair my estrogen to progesterone ratios, which will then impair my brain neurotransmitters. Now, I wanted to say this before I go to the break and before I give you the final plan, because this is where the PMDD concept comes in, and physicians say, well, then that's why we've got to use an SSRI. I do not deny the fact that brain neurotransmitters can be altered and dramatically changed in the latter part of a woman's cycle. I'm in agreement with you. If you're a medical practitioner, I don't disagree with you. The point is, why are they not imbalanced for an entire cycle? They are typically bad later in the cycle. This is where the instability comes in, emotional, and lability comes in. And then this is where the medical community says that then we need fluoxetines, we need whatever, SSRIs, because there's a brain neurotransmitter. I am telling you though, eating, and when I'm out of control, I then crave foods, sugars, processed foods, chocolates. I eat a lot of these bad things. That further feeds the cycle. The problem is, for many of you, you say, I can't control myself. I don't even have the willpower. I will eat if there's chocolate in a house, I will eat it all. I will go buy chocolate, I'll eat it all. I will go buy donuts and I'll eat cookies. I don't even know who I am. But as soon as that period comes, boom. But here's the bad part. The more you do that, it drives you deeper into this pit of despair with PMS. If you can follow, we're going to go to a break. If you can follow the plan, I'm going to give you the plan when we come back. It's going to be quick to the point. If you follow the plan, I'm telling you, I can almost guarantee you improvement. Stay with us. God bless you. We're going to go to a break. We're going to come back and we'll finish this up. Stay there. Thanks for being with us. Thanks for staying tuned. We're going to go back and just finish up PMS, PMDD. But before we do that, I'd like to just read you a little something out of Isaiah. It says, in the year that King Uzziah died, I saw the Lord high and exalted and seated on the throne, and the train of his robe filled the temple. And above him were seraphim, each with 6 wings. With 2 wings that covered their face, 2 covered their feet, 2 that were flying. And they were calling to one another, Holy, holy, holy is the Lord God Almighty. The whole earth is filled with his glory. Now this is referenced as well in the book of John, Revelation chapter 4. This is reiterated. And at their sound, the voices, the doorpost, the threshold shook, and the temple was filled with smoke. Woe unto me, I cried, said Isaiah. I am ruined. In other words, I am broken. For I am a man of unclean lips. And I'm going to just follow this for a moment. and I live amongst people with unclean lips, and my eyes have seen the King, the Lord Almighty. Then one of the seraphim flew to me with a coal in his hand. He had taken from the tongs with altar. He touched my mouth and said, see, this has touched your lips. Your guilt has been taken away and your sin atoned for. Then I heard the voice of the Lord saying, whom shall I send, and who will go for us? And I said, here am I, send me. Isaiah was completely willing to go and to submit and to surrender and serve God when he was exposed, not only in this vision that he saw, but how he was changed. And a couple of notes, just a couple thoughts, that prior to use, for any of us being used by God, we've got to have an experience with him. We've got to have a personal one-on-one experience like Isaiah had. Isaiah had an experience and an intimacy with God that so revealed the presence, the holiness, the majesty of God that it changed him immediately. He was so overwhelmed by the presence of God. And when God said literally, who can I send as a messenger? Isaiah, completely broken, I'm a man of unclean lips. Before we are used, we're usually going to be broken. I tell you, if you look all the way back through the Old Testament, you read through Old Testament prophets, you look at Old Testament figures, whether it's Joseph, whether it's Moses, whether it's Job, whether it's Joshua, every one of these men, even Ruth, you will look at every one of these men and women, they had significant issues, confrontations, difficulties, or problems where they had life-altering, changed experiences in his presence and that affected their work, their ministry from there on. And just a couple notes. Literally, that Isaiah's experience with God not only revealed the greatness, the mystery, and the power and the majesty, he recognized his sinfulness in God's presence. It encourages us to confess sin, to come clean, to ask God for forgiveness when we see or we are in his presence. This is just a takeaway message. When we see him, we see his greatness. We see our sinfulness, but he sees our forgiveness and gives forgiveness and his love. And he empowers us to serve as we submit and surrender. Before we're truly going to be used, typically there's a confrontation, if you will. There's an intimacy. There's a revealing of who God is, a revealing of who we are, sinful man, and literally a change that takes place. There's a cleansing and an intimacy that takes place before use. We can all say, God, use me, God, use me. And that's what we want for, I would hope that all of us, even those of you listening. But often there's a time of purging and cleansing before use. We see it with Isaiah. I hope that helps you. I hope that encourages you. Let's get back to the PMS, the world of PMS and PMDD here. If we're slipping back over, we're going to go right back to the board. And I started to write at the break a couple of things. One thing I forgot to mention, thyroid function, and I apologize, that in many cases, poor thyroid functioning and why you need to have your thyroid completely evaluated. Go back and view our live stream on all about thyroid. We need a free T4, we need a TSH, we need a free T3, because in many cases there's very, very impaired thyroid function that also leads into this. That should be evaluated. But for straightforward, I don't know what's wrong, I'm having all of these hugely magnified symptoms, physical, emotional, otherwise. I don't know who I am. I don't even recognize my conversation and my confrontations many times later in my cycle. What do we do about it? We put together a plan. Remember, you do not do these in singular fashion. Deficits, we've got to correct them. Where are the deficits? Many times there's impaired B6. The Bs in general, I put the Bs and then I put B6. There's obviously magnesium deficits almost always in this area. This plays huge into premenstrual syndromes. There are some zinc deficits that have been documented in the literature. So I say you start with something like a daily essentials. For you women, I would go higher, 2 twice a day, because I want some adequate B6 levels, I want adequate zinc, and I want the Bs in general. Daily essentials, 2 twice daily. And you do them with food. You start correcting some of the underlying deficits, number 1. Number 2, you can do a saliva panel. We would strongly recommend that you talk to our staff. You can contact us via email or the toll-free number, 888-865-9595. And you ask for speak to Terry, Amy. We have a number of staff members that can help you. Get you on a saliva test done so that we can see what your progesterone, your estrogen, and your testosterone levels are. But let's just say, for right now, the sake of ease, you want to engage in a plan. Correct deficits. They're always there. Usually all of these, or at least 1 or 2. I guarantee you if you have bad PMS. I promise you that. Number 2, there's often, probably in 60% to 70%, there's a progesterone deficit. So we can use some Transderm Pro, or if you live in the state of Pennsylvania, we can compound specifically. Come in, see our nurse practitioner. We could compound specifically doses for you and titrate them. Otherwise, we have you use more or less if you're out of the state of PA. Transderm Pro, 2% microionized progesterone. A lot of people are afraid of that. I don't want to talk about that. You need to have no fear. It's biologically identical. I want to stick on the focus of our intent here, correcting your deficits. Number 1, daily essentials, correct nutrient deficits. Number 2, balance hormone ratios, because they're a huge problem. Number 3, I've got to get you moving. Literature absolutely supports the fact that if I could get women moving and exercising and even walking, I detoxify naturally better and I can reduce many of my PMS symptoms. Exercise. Remember, we're doing these together, right? I'm going to do the daily essentials. I'm going to add some Transderm Pro. I'm going to begin walking, get on a treadmill, get on a bike. I've got to do something to help balance some of my brain neurotransmitters and my detox pathways. Fourthly, remember I mentioned the liver. I'm not metabolizing things. That means I'm recycling some of my hormone metabolites. I got to do some liver support. I3C complete. Indole carbanols. There's broccoli and cauliflower concentrates plus D-glucarate, calcium D-glucarate. Helps you to process estrogen metabolites. Eliminate them. You need to start eating more steamed broccoli, cauliflower, Brussels sprouts. You need to eat foods like that. Help your liver. Okay? Next, the good bacteria. We talked about our liver support. We talked about physical activity and exercise. We've got to now see that I've got to have good bacteria in here, right? Why the good bacteria? Because even if my liver acts on it and I dump it into the large intestine, I have to have quality fibers, right? I have to have quality fibers and good bacteria. And remember, I got to lower beta-glucuronidase, that enzyme that we all have. It's not bad. We all make it. When we make too much of it because we have bad bacteria growing, I cannot excrete. We deconjugate hormones. We send them back into our circulatory system. I've got to do a little bit of liver support. I've got to think about change of the diet. More fiber, more fresh foods. You say, but I can't. See, the reason why you can't often is because you're so emotionally out of control because of these other deficits. See, why I say you can't do just one of these at a time. See, notice usually I start with diet. Usually it's number 1 on the list. I could easily say, well, you know, you're a PMS woman. You're having a lot of trouble. You just can't eat all that sugar and junk and cookies. And literally then you want to claw my eyes out because you say you don't understand. I can't help myself. I want that stuff so bad. See, because your brain neurotransmitters are impaired, you're trying to feed them and you're consuming carbs. There's a temporary lift, then there's a dramatic drop in those neurotransmitters. So I have diet at literally the bottom of the list. Because if I start correcting deficits, balancing hormones, get moving, excrete better through my liver and through my gut and through stool, see, now I'm in a position to start making better decisions about my diet. All right? So the diet. Can you do some probiotics? I mean, really, all of you should be on some probiotics on an ongoing basis. So probiotic essentials. So what have we covered so far? Daily essentials. I3C complete. Help the liver handle. Good bacteria. The main thing is you've got to eat better at least. All right? And now I'm going to talk about, and we talked a little bit about Transderm Pro, the progesterone. I'm doing these in tandem. I'm doing them all together. I'm going to change structure and function. You say, well, what if I still feel very anxious? And, well, geez, well, we can always put you on some theanine or some Cabanase. But if we change what's going in and how we're processing, balance the hormones, I believe you'll have greater control over the diet. And then here's the ultimate key with the diet, to reduce the amount of carbs, the amount of sugar, eat more vegetables, eat more fruit, so I get more fiber. I have more good types of substrates to feed the good bacteria. I'll excrete my hormone metabolites that are affecting me. You know, really, there's some other things in here that make this even more complicated, but I don't want to do that. This is a very, very straightforward approach that will help you if you'll follow it. Now, I want to go back to the magnesium quickly. Magnesium is a key player. First of all, as a population, generically speaking, we do not get enough magnesium as a population, period, because of poor food supplies, us not even eating enough of the right foods, let alone those foods not having enough magnesium in them. I recommend that women consider additional sources of mag, like the mag essentials. You've got to use, you can't use mag carbonates, mag gluconates, mag oxides, and mag chlorides. They are junk. Seriously, they're junk. You've got to use a magglycinate, bisglycinate, or something like this. We call it a bioavailable mag, magnesium. Why? Because all of the carriers for magnesium are alpha-ketoglutarate, succinate, citrate, fumarate, malate. These are all Krebs cycle intermediates that your cells recognize immediately and say, you, I know, I want you in my cell, I can use you. You've got a carrier for magnesium. Mag deficits are used. Women with PMS should be on 2 mag essentials twice daily. At a minimum. I might even, depending on how you do, I might even bump you up. So we've got daily essentials, critical. We've got some I3C complete, help the liver. Here we're going to correct imbalances and nutrient deficits, generically, globally. I3C to help my liver to process. I'm going to use some Transderm Pro to begin to, we'll talk about this. You can use like a 1/4 teaspoon. I would start at a minimum 1/4 teaspoon day 14 through 20, and then a 1/4 teaspoon twice a day 21 through 28, depending upon your cycle length. Or if you have a lot of issues, I'm just going to have you do 1/4 teaspoon twice a day, probably about day 14 through 28 until your period begins. Reset the bacteria. See, if I start doing this, then I can get a better control over my diet. Now I start reducing carbs, sugars, whites, refines, bad fats. A lot of saturated bad fats, deep fried fats, feed this process. It's actually documented that the very thing that women with PMS and PMDD do is the very thing that feeds their destruction. Eating poorly, rancid fats, French fries, deep fried foods, sugar, whites, and refines. That impairs brain neurotransmitters and feeds the cycle. You begin to replete mag with mag essentials, I'm telling you, you'll have a huge, huge, huge benefit. I hope this has helped. I believe that it will. If you follow our plan, I am convinced, I don't need to convince you, I believe if you follow this plan, you are on the path to correcting the underlying problems. Remember, there's deficits, there's imbalances, there's impairments in removal. If you correct them, I don't believe that you need to be on oral contraceptives per se to suppress your hormones. And I don't really believe necessarily, unless you have an underlying, severe depression, that you need to be on those pharmaceuticals. If you've been told that you just need to do them during specific periods of the times of the month to help you get through, you need to realize that I could stop the change and shift in those neurotransmitters if I follow a plan. And here's your plan. God bless you. Thanks for being with us. I hope that you find this helps you. The other live streams that we have available for you are all geared, whether they're men's health, erectile dysfunction for men, heartburn, reflux, migraines, headaches. We've got a lot of good teaching out there for you. It's sensible. It's a down-home approach. I don't make any vain or strange promises to you. I would really never want to do that. I feel my approach is one that just deals with rudimentary facts, trying to deal with them and not in some esoteric sense. I forgot one thing that I almost can't believe that I forgot. Very important. The other part of this is, if all of this is not working, then I'm going to add in something like balance. And the reason why I'm going to do it, the one key ingredient here is chasteberry, 10-to-1 ratio, 20 milligrams of aucubin or acubicin, which is Agnus castus, has a little bit of peony and a little bit of licorice root. Balance. Excellent. This is last on the list. After we've corrected some of the basic things and I'm still not getting results, we come in with something like balance and we add that to the regimen. God bless you. Thanks for being with us. I hope you learned something. Do yourself a favor, your family a favor. Engage in the plan. You need specific help, 888-865-9595. Send us an email on the website. Let the staff, let Terry, let Amy, let Joyce Gibb, our nurse practice, set you up for a time. We'll get on the phone no matter where you are. We will recommend labs to be done. We can ship some of these things. We'll give you the plan. We'll give it to you in black and white on paper. God bless you. And I hope that you got something out of the teaching from the book of Isaiah. If you truly want to be used by Him, you've got to be in His presence. And when we're in His presence, God deals with us. He burns away the dross. Unfortunately for us, He reveals our sinfulness, but it's very fortunate that He does. When He does that, you're prepared. You're fit for the potter's use. There's cleansing that takes place before use. God bless you. Thanks for being with me. See you on the next live stream.